is Alvaro Marin. Today I'm going to teach you guys the steps on how to become an anesthesiologist. So basically, I found a short video that is going to explain to you guys what an anesthesiologist does in his day-to-day life. So just pay attention to the video, and you guys will learn a couple things.
Physician, so we're involved with care from the moment you are scheduled for surgery. We'll see you before surgery and obviously take care of you during surgery, and then we are there also after the procedure to make sure that you are comfortable and you're safe and the whole process goes smoothly. Before surgery, we oftentimes will interview you and ask you questions about your medical history and your surgical history in an effort to prepare a safe anesthetic plan on the day of surgery. And then you'll see us the morning of the procedure, where we'll answer any other questions you have and then begin the whole process of anesthesia, which of course would involve keeping you comfortable for a procedure, oftentimes putting you asleep for a procedure, and then during the procedure monitoring you and ensuring your safety. And then afterwards we're there to make sure you remain comfortable, and if any problems come up, we're there to help you with them as well.
Alrighty, so that video kind of just emphasizes the main key factors of what an anesthesiologist would do in his day-to-day life. So just to rephrase that, anesthesiologists help ensure the safety of patients undergoing medical procedures or surgeries. We're there for the patient to prevent the pain and the stress that they will sometimes experience throughout a procedure. Most of the times for surgery, they are put under full anesthesia, meaning you are basically unconscious, you do not feel anything, no pain, and when you wake up, it takes a few hours for the medicine to get out of your system in order for you to start regaining function again. So it is a really good benefit that we have now in society, because back in the day, there were no anesthetics like this that could help people through surgeries. So that is a very good thing. So now to steps of becoming an anesthesiologist. You must have an undergraduate degree. It doesn't have to be in medicine specifically. It can be a psychology major, it could be a business major before you apply to medical school, but it does recommend that you do go for a pre-med track or biology, health sciences, any degree that is medically related. After you finish your pre-med, your undergrad, you will have to apply for medical school using the MCAT, which is the Medical College Admissions Test. It's like the SAT. It just helps you prepare for what you are going to learn throughout medical school, and you have to start studying that about 2 to 3 years before you begin your medical career. The step 2, like I said, the MCAT is a major step into applying for medical school. The higher the score, the better the chance you have of getting accepted. Medical school is 4 years of more studies, but there you're going to learn all of the skills that you need to be working in a health setting, medical setting. You will learn anything from surgery, pediatrics, anything like that. It's a whole broad spectrum that you're going to be working with while you're in medical school, and it's the place for people to decide what they want to do with their career, where they want to go, if they want to go into surgery, if they want to go to pediatrics, gynecology. There's just so much to do in the medical field, so medical school, I believe, is one of the most important steps of your journey. After you finish your medical school, hopefully you have pretty good grades and you learn the skills that you need, because then you have to apply for a residency program. Depending on what your specialty is, residency programs are much harder to get into than others. Some are more competitive. Many schools have these programs. For anesthesiologists, they recommend Johns Hopkins and up in the north of North America, and same thing with Harvard University and Stanford are one of the most renowned residency programs. So talking about residency, you cannot get your license for anesthesia without your residency program. There's just no way it can happen. The program does take anywhere 3 to 4 years for an anesthesiologist. One of the main key factors, it's very important that you do at least 80 hours a week. Even though that may seem like a lot of time, it is time where you're going to be learning, you're going to be working with doctors, shadowing doctors, and once you finish medical school, you technically are a doctor, but you cannot call yourself an anesthesiologist until you finish your residency program. And so once you finish your 80 hours for residency, you basically get in the habit of being there for a long time, because anesthesiologists are in the hospital for a long time because we are there for the surgery, throughout the surgery, and after the surgery. But the good thing is that anesthesiologists can be working 3 times a week. So if you plan to have a family, this is the job for you. You can have the time to travel, spend time with your family, and build upon your career. And so the salary for an anesthesiologist on an average is 300 to 500K. The top paid anesthesiologists get anywhere from 700 to 800K a year. So it's a pretty good lifestyle that you do get to live. And so these are just all my sources that I use throughout my presentation. Thank you guys very much and have a good day.